Okay, welcome to Anatomy and Physiology 1. I'm Dr. Stephen Lindner, and tonight we're going to talk about the introduction to anatomy and physiology. So what exactly is anatomy and what exactly is physiology? It's a very simple concept. When we talk about anatomy, we're really talking about structure or form. And when we're talking about physiology, we're talking about function. So anatomy and physiology is really the study of structure and function, or form and function, whichever terminology you feel comfortable with. When we talk about anatomy, we can study structure in a variety of ways, right? You can look at it superficially, meaning you don't need a microscope to analyze it. You can look at someone's elbow joint or shoulder joint or knee joint, observe how they move it, and use your critical thinking to try and figure out how that joint may be designed. We can also study anatomy through invasive procedure. We could do a dissection, we could do X-ray, MRI, Doppler ultrasound, CAT scans, right? All different ways of looking inside of the body to look at the structure. In terms of function, physiology, we can understand that muscles contract, but how do they contract, right? So we'll be getting into a little bit more of how things function in this course as well. We call that physiology. Now, one of the first things that's really important to understand is this term called anatomical position, because what we're going to be looking at are muscles eventually and bones and looking at different body parts. And you have to be able to, in healthcare, to be able to understand different types of terminology where, let's say you're with another healthcare professional and someone says, okay, client number one over here has pain at the medial side of the elbow. Well, you have to know the medial side of the elbow is here. Now, if they say, oh, uh, it's the medial aspect of their arm, now we know that this is the arm, and I know this is the medial aspect, but maybe the other individual thought this was the arm. Okay, so it's really important to use proper terminology. Arm, forearm, right? When someone says their hip hurts, are they referring to the hip here, or are they referring to their lower back, right? So we have to use this universal language, and starting with anatomical position is the most important. Anatomical position means the individual is standing erect with the feet flat on the floor, palms facing forward. When I say the palms are facing forward, I also can use the term anteriorly. What we see here is this individual from the anterior view, meaning the front view. What we don't see is what's on the individual's posterior, on the back side, okay? Another way of saying her palms are facing forward in this particular direction, they're also supine. Supine means they're facing us, this direction. Okay, so anatomical position. And I will go over these terms, medial, lateral, superior, inferior, in a little bit. So superficial anatomy means these are structures, any structure that's located near the body's surface, right? We don't need a microscope to see them. They're superficial. So the hair on your arm, the skin on the external, meaning the epidermis, that is all superficial anatomy. But deep to the epidermis, which is that superficial layer of skin, is a deeper layer called the dermis. Okay. Anatomical landmarks. We start with anatomical position. That's the hands at the side, the palms facing forward or anteriorly. Another term is supine, which is when you're lying down face up, or prone is lying down face down. So supine is when you're lying on your spine. Supine is when you're lying on your spine. And prone is when you're lying on your bone, right? Your nose. So this here in this quiz question, or if this test question ever appeared, whether it was a picture or description, person lying face down, which best describes that, that would be prone. In this particular case, down here on the bottom, we see again prone, which is lying down, and it is the opposite of supine, which is the top picture. So supine is lying on the spine, which is facing up, and that's the opposite of prone. Whereas in the middle, this is anatomical position. They're standing upright with the feet flat on the floor and the palms facing anteriorly or facing forward. We can use the microscope to look at anatomy, especially if we want to look at some microscopic deeper anatomy, such as the cell. Whenever we study cells, we call that cytology. So cytology means the study of cells and the structures within the cell. And this is one of the things you'll be doing this week, is looking at the cell, especially in the lab portion, okay? The cell has many organelles within it, and it's important to know the structure of the organelles as well as the function. I mean, after all, it's anatomy and physiology, the study of structure and function. You should know what they look like to be able to identify them and know their primary functions. So do you know what the mitochondria looks like and what is its function? Do you know what the nucleus looks like and what is its function? Do you know what the smooth or rough endoplasmic reticulum look like and what are their functions? What does the cell membrane look like and what is its functions? Okay, so anyway, that's cytology. Now, when a bunch of cells come together, they make tissues. And when we study tissues, we call that histology. There are 4 basic types of tissues. We'll be talking about tissues a little bit more in another lecture, but I'll lay down some foundational work now, so at least you've heard the terms once before. And a big portion of getting comfortable with anatomy and physiology is just hearing the terms, hearing it over and over and over. You don't learn the lyrics to the song hearing it once, but several times on the radio, right? Or on iTunes or whatever you're listening to these days, right? You finally know the lyrics. So repetition works, repetition works, repetition works. So the 4 types of tissues are called epithelial tissue, connective tissue, muscle tissue, and nerve tissue. Those are the 4 types. Epithelial tissue, connective tissue, muscle tissue, and nerve tissue. Now, since we mentioned here cells and tissues, it's really important to know the levels of structural organization. After all, how does an organism created? How is it created? Well, we're made up of chemistry. We're made up of chemicals. Whether we think of carbons and hydrogens and oxygens and nitrogens and phosphates, sometimes the little acronym or mnemonic for this is COHN, C-H-O-N or C-O-H-N, COHN, carbon, hydrogen, oxygen, nitrogen. Of course, P is for phosphate. But chemicals, or even think of carbohydrates, proteins, and fats. That's chemistry. But carbohydrates, proteins, and fats are still made up of carbon, hydrogen, oxygen, nitrogen, and phosphates. So chemistry comes together when chemicals come together, and even these chemicals have a structure, right? This is DNA. This is a double helix. This is a structure. So chemicals come together and form cells. When cells come together, they make tissues. Remember I said there's epithelial tissue, connective tissue, muscle tissue, and nerve tissue. Now, when you have a bunch of tissues of similar importance and function that are going to be working in harmony together, then those tissues are going to make up organs. In this case, we're looking at the stomach. Now, when organs that have similar purpose come together, like the stomach and the esophagus and the liver, and the pancreas and the small intestine and large intestine. Now we have a digestive system. So organs come together to make systems, and then we have 11 systems that I'll talk about, and like the digestive system, respiratory system, immune system, um, uh, cardiovascular system, bony system or osteology, the muscular system, the endocrine system, the neural system. All of these systems come together. There are 11 of them to make the organism. So again, chemicals make up cells, cells make up tissues, tissues make up organs, organs come together to make up systems, and the systems make the organism. Again, chemicals to the cells, cells to tissues, tissues to organs, then organs to systems, and eventually all of the organ systems come together to make the crowning creation of all, the human organism. So I'm going to pause here, we take a break, and when we come back, we'll talk about these 11 systems.